Hi, everyone. This is Sean with the MassSupport Network, here with your COVID-19 update of the Massachusetts Weekly Public Health Report for Friday, March 26th, 2021. So the long and short of this update is going to be that things are heading back upwards in Massachusetts, and that's not great. Pretty much every metric we're going to see here is slightly worse than last week, which is not good. To start off with, the estimated active cases are up just under 2,000. So that's going to be the theme of the update today. When we look at last week's quarantine and monitoring, this is people with suspected cases or awaiting testing. This is not going to be up as much. It was 9,659 last week. This week it's 9,708. Not a big jump there, but we have to remember, of course, that this metric is going to be the wonkiest these days because A, we're doing a lot less testing right now. And part of that is also because a lot of people are vaccinated and don't need to quarantine after exposure or travel. So there's less reason for people to be in quarantine at this point. And so that's not really a good metric to look at to see how we're doing anymore. However, isolations, which are people with confirmed cases of COVID-19, are up a bit from just over 25 to just over 27,000. So it's a jump of about 2,000 additional cases from where we were last week. These are active cases. These are people who are in isolation currently for confirmed COVID-19 cases. And that's a bit more. And as it starts to rise, it may start to rise faster if we don't turn it around. So when we look at the average age of hospitalization, that's gone up about 2 years. Average age of death has stayed about the same. Not much about those trends here, but when we look at hospitals, so while ICU and intubations are down from last week, the actual number of hospitalizations has increased, and that's not what I'd like to see. So these may be trailing because these are generally going to be not necessarily new cases are going to move on to these more advanced measures, but this means that more new cases are coming in, even if there's fewer serious cases in the moment there. As more new cases come in, we may start to see more people go into these other areas. Now, none of this is especially high right now, so it's not currently a cause for immediate alarm, but we want to make sure we don't start trending upwards in general again here. Testing turnaround time has come down significantly. The average turnaround time from a test being sampled to getting to the Department of Public Health is now just about, about 30 hours, barely, a day and a quarter there, which is pretty good. But unfortunately, a lot of that is probably because of test volume, where we're not seeing a whole bunch of tests anymore. I mean, we're still at a high level, but not as high as we've been. We're seeing a lot of up and down spikes in testing where we're dropping off for a little bit and coming back up. When we talk about contact tracing, this is more or less holding steady. The top graph there has a repeated number, but when we look at the last week, things are a little bit down from where they were, but more or less there. And again, I really don't expect us to ever get out of that kind of mid 80% level. Just because some people, we're never going to get to everybody. Some people are just hard to reach. So that's about where we can hope to stay. But while we're staying there, that is good. If we start to see some drop-offs there, and they are trending down a little bit, we'll know that we're kind of getting a little overtaxed, and that's part of what leads to surges, and we can't quickly test, trace, and isolate. So looking at the counties, unfortunately, almost everywhere is trending up. Last week, the state average incidence rate, the daily number of cases per 100,000 people per day for the last 2 weeks was 19.5. Now it's 21.5. We've come up 2 full cases per day. Now, most counties have trended upwards, some jumping significantly, especially Barnstable and Berkshire County, which they are. Most of the ones that are trending downwards are just a little bit, like Worcester. Hampshire's county is the only one that is it had a significant decrease, and that is again because they are still coming down from that high they had following the UMass Amherst outbreak. But everywhere else that trended downward was just a couple tenths of the case mostly. When we look at the percent positivity, the percentage of tests that are coming back positive, these are increasing as well. So it's always the light blue line at the bottom is the screening tests done at higher education institutions, which, as they are screening tests, are more likely to be negative and pull the average lower. The blue line is the all Massachusetts, and the gray line is with the higher education testing excluded. And that gray line is then probably the most relevant testing, because we're not testing people who are perfectly healthy, who have no symptoms and have had no exposure. And that has come about 0.5% in the last week, which is a pretty big jump there. And you can just see in the curve there how that's going. Now, some of that is due to testing drop off, but a lot of it is going to be just increased case counts, as we will see. This is the 7-day average for Massachusetts since the beginning of February. You could go further back, but it'll get to a point where we get into the January numbers, which are so much higher that it throws off the whole curve. So as we can see, we came down and reached a low peak in the first week or so of March. And since then, we've been sort of slowly trending back upwards. A week ago, it wasn't quite as apparent, you can see, but we have been steadily going up and getting a little faster there. Till at our low point, we were about maybe 100 and, as that like 1,200 new cases a day. And now we're up to probably about 1,700, 1,800 new cases a day on average, which is a pretty big jump for, for just 2 weeks, really. So that is an unfortunate trend there. So if we look at county by county, it varies from place to place. This is just looking in the last 2-3 weeks here. This is the counties that have the lowest raw transmission. This is not by population. And as we can see, Franklin County and the islands have stayed, more or less in their level, perhaps coming slightly up towards the end here. Hampshire County has been on this downward trend here, perhaps ticking up in the last day or so, as we've seen. Berkshire County, however, has steadily grown, and I can't really account for that unless they reopened indoor concerts at Tanglewood or something. But that is that's still not a huge amount. When we slip to the next slide and we see the larger counties, but that is a definite spike there. Now over here, we see a lot of sort of the same story here, things that were lowish at the beginning of the month and then have slightly increased. If we take, for example, Suffolk County from where it was, follow the line upwards, and we're probably, maybe about 50 cases more than we were seeing. Some worth calling out though, however, Hampden County, which was actually decreasing for a while, has started going up significantly. Bristol County is a little hidden here, starting around 100 and having a pretty significant rise up to above 150 new cases per day on average. These are all 7-day average numbers. The ones we're spending out are, of course, Middlesex County up at the top, which has usually been the highest, has had the most significant increase in raw cases. And this is going to be hidden because it's a very high population county. So in the incidence rates, we're not going to see that as much or as sharply. But that is still a pretty big increase there. That's about over 100 new cases since the low part, the lows of March 8th and 9th. Also worth pointing out is Barnstable, which what used to be on the previous slide, but I had to move over this one because it's gotten so much higher that it's going to make the other counties almost invisible. That's jumping significantly for its previous case count and its population. That is a pretty big uptick there. So we got to start pulling it together before we lose this one again. One last thought as we go into our weekend. Probably have heard by now, Krispy Kreme is offering free donuts to people who show their vaccination card. 1 free donut per day for the rest of the year. There's a lot of other companies and businesses that are following suit and offering free stuff to people who've been vaccinated. Of course, there are no Krispy Kremes in Massachusetts, unfortunately, but there is some back and forth about this, whether that's an appropriate thing to do, whether it's an incentive to get a vaccine, or if maybe it's just a incentive to come back and start patronizing businesses after you get your vaccination. There's some argument there, but hey, donuts are nice. So, look for something like that in your area. All right. For more from the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands. We'll be there if you need us. Stay safe.